AKI and CKD are the most important topic from the renal system, and today let's start with AKI, acute kidney injury. It's a sudden decrease in kidney function that occurs over hours to days, leading to retention of waste products like urea creatinine, fluid imbalance, and electrolyte disturbance. Usually, it is characterized by rapid increase in serum creatinine and decrease in urine output. And there are three main causes: pre-renal, intrarenal, and post-renal. In the pre-renal causes, there is reduction in blood flow to the kidneys, like due to hypovolemia, heart failure, shock, or renal artery stenosis or sepsis. In the intrarenal causes, there is damage to the kidneys or tissues, for example, acute glomerulonephritis, nephrotoxic drug, and acute tubular necrosis. And in the post-renal AKI, there is problem after the kidneys, like obstruction in the urinary tract because of the kidney stones, enlarged prostate, or tumors, etc. Now let's go on the clinical manifestations of AKI. Oliguria, decrease in urine output less than 400 ml per day, edema, electrolyte imbalances, hyperkalemia, hyponatremia, metabolic acidosis, elevated blood urea nitrogen, creatinine, fatigue, weakness, confusion, nausea, vomiting. So now the nursing interventions in case of AKI, we need to monitor the vital sign of patients, including urine output, monitoring lab value, watching for creatinine and blood urea nitrogen level or electrolyte level is important. We need to maintain fluid balance. We need to educate patient regarding patient condition or providing needed education, educate on avoiding nephrotoxic drugs like NSAID, adherence to prescribed diuretics or dialysis schedule, importance of regular follow-up with healthcare providers. And the key NCLEX points are like understanding the cause of AKI, like pre-renal, intrarenal, and post-renal types. It is important. And no clinical manifestations of AKI, change in patient urine output, electrolyte imbalances, and fluid retention. Be familiar with diagnostic tests like serum creatinine, blood urea nitrogen, and know the treatment strategies including fluid management, diuretics, dialysis, addressing underlying causes, monitoring vital signs, lab values, and urine output frequently. And for the management and treatment of AKI, first of all, we need to manage fluid level. In case of pre-renal AKI, IV fluids like NS or RL are infused. In case of post-renal AKI, relief of the obstruction like catheterization for urine retention, surgery for stones. In intrarenal AKI case, focus on treating underlying cause like discontinuing nephrotoxic medications. For the electrolytes management, in case of hyperkalemia, calcium gluconate to stabilize the heart, sodium bicarbonate or insulin glucose for shifting potassium into cells, Kyaxalate for removing potassium if renal function permits. Dialysis may be needed in severe AKI with complications like life-threatening hyperkalemia, severe fluid overload, uremic syndrome, and the medication used in AKI are like diuretics and ACE inhibitors. Okay, the next topic is CKD, chronic kidney disease, also the important topic for the NCLEX. CKD is the gradual loss of kidney function over time, typically over months or years. The main thing to remember is GFR, which is best indicator of kidney function. A GFR of less than 60 ml per minute for 3 months or more is indicative of CKD. In stage 1 CKD, there is normal GFR. In stage 2, there is mild decrease in GFR 60 to 89 ml per minute. In stage 3, there is moderate decrease in GFR 30 to 59. In stage 4, there is severe decrease in GFR 15 to 29. In stage 5, there is end-stage kidney failure less than 15 ml per minute. The risk factors for CKD are diabetes mellitus, hypertension, family history of kidney disease, age factor, chronic glomerulonephritis, polycystic kidney disease, smoking, obesity, and all the region or causes of the acute kidney injury or AKI. And the clinical manifestations of CKD in early stage or CKD stage 1, CKD stage 2, there is often asymptomatic or mild symptoms. Then proteinuria, hematuria, fatigue weakness. In moderate stage, there is edema, swelling, especially in lower extremities, hypertension, electrolyte imbalances, anemia. In this stage, there is uremic symptoms, severe electrolyte imbalances, oliguria or anuria, and increase in blood urea nitrogen and creatinine level. Let's go over the management of CKD, control underlying conditions like diabetes, hypertension, medications like antihypertensive, erythropoietin stimulating agents, phosphate binders, vitamin D supplements, diuretics are used in case of CKD. Then for dietary management, low sodium diet, protein restrictions, phosphate restriction, potassium restrictions. And in case of end-stage renal disease, the hemodialysis or peritoneal dialysis will be performed. And in the final stage, kidney transplant might be the option. Okay, the nursing interventions for the CKD: monitor vital signs, monitor lab values, monitor urine output, report significant changes, educate patient on adhering to prescribed medication, fluid restriction, and dietary recommendations. Teach the importance of regular follow-up, especially when the patient has comorbidities like diabetes or hypertension. Encourage lifestyle changes, quitting smoking, weight loss, and exercise. Avoid potassium foods, high sodium foods, and dairy products. Encourage for protein diet, low sodium diet, fluid restriction, high calorie, high protein for patient on hemodialysis. And the complications are like hyperkalemia, fluid overload. Strictly watch for the sign and symptoms of electrolyte imbalances. In case of hyperkalemia, there will be peak TOF, and also watch for fluid overload like weight gain, edema, shortness of breath, and during hemodialysis, monitor for hypotension.